Millions of people worldwide rely on psychotherapy and medication to manage mental health conditions such as depression, anxiety, PTSD, and schizophrenia. But how effective are these treatments really? A massive umbrella review analyzing over 100 meta-analyses and nearly 4,000 clinical trials provides a clearer picture. The results challenge some common assumptions about mental health treatment and suggest that while therapy and medication can help, their benefits may be more limited than previously thought. This study examined 650,000 patients and compared different treatment options. The key question was, do psychotherapy and medication work better than placebo or treatment as usual? The findings showed that while both treatments had positive effects, the impact was small to moderate across most mental health conditions. For psychotherapy, the average effect size was 0.34, and for medication, it was 0.36. In simple terms, while both options help, the improvement is often modest. For conditions like obsessive-compulsive disorder, OCD, and post-traumatic stress disorder, PTSD, psychotherapy showed stronger results. However, when looking at depression, anxiety, and schizophrenia, the differences between therapy, medication, and placebo were often minimal. Interestingly, the study also found that combining therapy and medication had slightly better outcomes than using either one alone, but the difference was still small. One example that highlights these findings is a patient, let's call her Sarah, who has struggled with depression for years. She has tried both therapy and antidepressants, and while they helped her feel better, she didn't experience a dramatic transformation. The study suggests that Sarah's experience is common. Many people improve, but the changes are not always as significant as they hope. However, Sarah found that a combination of therapy, medication, and lifestyle, changes like exercise and social support made the biggest difference. This aligns with the study's conclusion. Mental health treatment works best when it's part of a holistic approach, rather than relying solely on one method. One of the most striking findings of the review was the high risk of bias in many clinical trials. Studies with stronger methods showed smaller treatment effects, suggesting that some previous research may have overestimated the effectiveness of therapy and medication. The authors argue that after decades of research and billions of dollars invested, the improvements in treatment outcomes remain relatively small. This raises an important question. Do we need a new approach to mental health treatment? Rather than seeing therapy and medication as cure-all solutions, this study suggests that mental health care should focus more on personalized treatment, prevention, and alternative approaches. While therapy and medication help many people, other factors such as social connections, physical activity, and early intervention could play a much bigger role in long-term recovery. If you or someone you know is considering treatment for mental health, the key takeaway is this: therapy and medication can be helpful, but they are not magic fixes. Combining different strategies, staying informed, and working with professionals to find the best approach can lead to better results. The future of mental health care may involve a shift towards more tailored and innovative solutions, ensuring that more people get the support they truly need.